Good evening, how are you all? I'm very pleased to be with you here tonight. I haven't done a live Facebook video for a very long time, and I'm starting now to present some videos because I have been asked so many questions, and it's really nice to explain to my patients how this will work in terms of chronic pain. So I'll just introduce myself initially. My name is Dr. Mubarak, and I am a chronic pain specialist. My clinics are in Galway and in Dublin, and sometimes I conduct some video consultations in case the patient is old and he cannot travel to attend the face-to-face consultation as well. There is a lot of queries came to me regarding the chronic pain. So let me introduce to you first what is chronic pain. Chronic pain, in fact, it is something that when your pain is more than 3 months, and any pain that is lasting less than 3 months, it's called acute pain, while any pain is more than 3 months is called chronic pain. So let me now tell you something about what is the pain, why it is called the pain. And a lot of people think that chronic pain or pain in general is a bad thing, but we call it in the pain medicine as the sixth sense. This is because the pain actually warns the human body regarding the problem that is coming down the road. So initially the pain will be very little, it will increase with time, it comes and go initially, then it becomes constant. My advice to everyone is not to let the pain control your life. Initially, the patient thinks that it might be something simple, it might go away. He try paracetamol, he try ibuprofen, he try maybe tramadol sometimes through the GP. But the pain comes and go, and then at one stage, the pain doesn't go at all. It is constant. Constant day and night, or during the day only, or during the night only. There are patterns in pain. And the brain of the human body is really a smart organ. So the pain actually in the brain has a memory, and that is the problem when the chronic pain is lasting for more than 3 months, because the brain will start to recognize that pain. And even if you have, say, had a back pain, for example, you had a disc prolapse, you have removed the disc, and after surgery you still have back pain. This is called, sometimes we call it failed back surgery syndrome. Sometimes we call it non-specific low back pain. There are so many reasons and causes of this pain, but one of the things is that there is central changes in the brain that occur, and this is in fact cause the pain to be nagging and constant even when you remove the original cause of the pain. So if you have a fracture, say, and the fracture is fixed and everything is done and dusted, you still have pain in the arm or in the leg. And this is the real problem with chronic pain. So I wanted really to explain this to everyone because people don't understand. Sometimes they come to me in the clinic and say, I was perfect. And then suddenly, out of the blue, I started to have severe pain that disturbed my life and turned it upside down. The other problem with the pain is really when you look normal in the outside. All your relatives, family, friends, your colleagues at work, everyone, when you say, I have pain, they will tell you, oh, but you look great. You know, the lady can put makeup to look fine, the man can dress well, but he is still or she is still in a lot of pain. So physically, the patient can look from outside very well and very good, but nobody know or feel what he is feeling. And this is really my job. So when you come to me in the pain clinic, I exactly acknowledge and know what you are feeling. Partly because I'm a human being, I can feel what you feel and I sympathize with what you say and I know exactly what you feel. So I feel this. And the other part is that I have the science to understand and to know why you have this pain problem. Many patients, especially patients say with fibromyalgia, widespread pain that is unexplained, functional neurological disorder, so many types of things where everything looks normal, but the patient in severe pain. And after they tell me the story, and I tell them, oh, I know what you're talking about. And the patient say, do you believe me? I say, yeah, I believe you. He say, everyone's saying to me it is in my head. But I say to him, no, it's not in your head. And I start to explain the process. What happens in the brain, what happens in the chemicals, what happens in his nervous system that lead to this issue. So really it's important to acknowledge and to understand the science. And that's why I'm explaining today why you might have a chronic pain and what happens in the body with the chronic pain. So we said about the pain memory in the brain, and we said the central hypersensitivity in the brain cells and also in the nervous system, in the spinal cord and in the peripheral nerves. So all of this information I always discuss with my patients when they come in the clinic. The first appointment is usually a long appointment because I try to explain everything to them. A lot of information will be given to them to understand why they feel in that way. So let me move now to the next part of my discussion about, which is regarding why you should treat chronic pain. So you might be functioning okay or not. You might feel okay or not. You might try to bypass the problem and try to avoid talking about it or do distraction techniques, which might not or might work or not to work. So patients are asking questions about how we manage chronic pain and why we should treat chronic pain. I have received many questions through the messenger and WhatsApp texts about these two questions. So first of all, regarding how to manage chronic pain, there are so many different things to manage that. Sometimes it is injections, nerve blocks, sometimes it is medications, sometimes it is infusions, and the infusions are rarely offered actually in the public and in the private sector because they are time consuming. They may take 1 hour. Some doctors are not believing in infusions, but from my experience, infusions could do very well, either alone or in conjunction with other modalities of pain treatment. So my approach in general will be a multimodal approach to pain management. I don't offer one single thing because I know very well from my experience that pain could be quite aggressive and severe. Patient usually has tried all the simple things before he came to my clinic. Usually they have gone through many consultants in many specialties and through the GP as well. So may have gone through the orthopedic doctor, the spinal doctors, to neurology doctors, to of course the GP as the first line, and they could try as well rheumatology doctors. So patients usually really come to the end of the road when they come to me in the pain clinic. Regarding how to manage it, so medically, there is medications as I mentioned, and there are different types of medication. You need to bear in mind that sometimes you don't use the medication in the correct way. You don't have the correct combination or regime of medications. You don't have the correct doses of medications. I might need to customize the medication plan according to the medical history and the condition of the patients, because there are so many interactions can occur with different other tablets where the patient is taking already. So medication itself is a big sector in the treatment, and my patients usually have a medication plan, and after a month they will have a follow-up consultation with me to discuss. We might change doses, regimes, add something, remove something, so many things. Regarding the infusions, it could be lidocaine, it could be a combination lidocaine and ketamine, it could be combination lidocaine and magnesium. There are different regimes as well that I use in my clinics for my patients. And regarding injections, I cannot name the number of injections that can be done. It can be ultrasound guided or X-ray guided, and I only offer injections under these two things. So I don't offer any blind injections. I always like to see the nerve or the muscle or the area near the tendon, and diagnose the problem and then offer the treatment. So next, other non-medical modality of treatment could be physiotherapy and rehabilitation. But I need to inform everyone that physiotherapy really cannot be done if the patient is in pain. Usually the physiotherapy will give relief maybe for a very short period, and then the pain return again, because in fact the original problem was not solved. Or the physiotherapy can aggravate the pain, and the patient is not able to do the exercises, because in fact the pain become worse. And sometimes the physiotherapy cause, when the patient in a lot of pain, it can cause more inflammation in the muscle or in the joint, and the patient can do a wrong movement as well at home. Some patients go and do yoga and Pilates on their own, and the pain becomes severe and severe, much more than it was. So I do not advise really to do any exercises while you are in pain. The first step is to have pain relief through a pain management consultant. As I mentioned, multimodal approach. And then I send you to the physiotherapy with a recommendation to start with gentle exercises. Any exercise that cause pain, I advise all of you, please listen to your body. You don't need to do exercises that is causing more pain problems. But I don't really as well advocate that you rest and stay in bed all the time, because this might also aggravate the pain problem. So you need to have the balance. You need to come to seek help first. You can come to me in the clinic or do video consultation, or you need to start to manage the problem, and not to distract yourself away by having other things, and you think it's gone, but actually it's not gone. That is the worry, because the more you leave the chronic pain, the more you will have problems down the line. I've treated more than, I think at the moment, about 15,000 patients. I've done only in the last 1 year about 2,500 patients. So I've seen a lot regarding chronic pain, and I know exactly where you are coming from. And I definitely can listen to your story and tell you what is the future prediction for your problems. Now, the second part of my talk is about why we need to treat chronic pain. The chronic pain, I call it, is a monster. I tell about chronic pain to my patients. It's really a monster, because it will keep bigger and get more and more and more out of you. So if you start with a back pain, usually you will, after a period of time when you leave it, you will have neck pain. And after that, and the pain will start in neck in one side, then it will be on the other side of the neck. Then the pain might go to your legs and your hips, and then it might cover the whole spine from the neck to the bottom. So the pain is a connection of neurons and nerves and chemical transmitters and hormones and substance B and many things. So the pathophysiology of chronic pain is huge. Like, this is the most difficult part to explain when it comes to neurons and the neurotransmitters. I advise you, don't neglect chronic pain. First of all, it's going to extend to other parts of your body. And if you have one knee with a problem, you will have then hip on the same side with the same problem. Then you will have other knee problem, because the mechanics of the body, you use involuntarily the other knee more than the painful knee. And this will end up with erosion of the normal knee. And this lead to hip pain and then back pain. And then it will keep going on and on and on. So why we need to treat chronic pain is really because you don't need this pain, or you don't want it to extend to other parts of your body. Secondly, you might have actually a very bad negative impact in your life with chronic pain. I will not talk about the psychology section. Of course, psychologists will talk much better than me about this. But I'll give you very simple examples of what can happen. The mood become low. Patient might get depression. Patient might get also an anxiety about their activities. They might not be able to do the tasks in life that they want to do every day. This leads to bad, like a lot of frustration from the psychology point of view. And then after that, a very complex thoughts and behavior changes do happen to the patients, because they started to think about how to process, their body to accommodate this pain. And this end up with a certain we call, behavior as an outcome of the thoughts process. So they might leave tasks, they might start doing activities, might stop things that they enjoy, and this lead to more frustration and more depression. That's on the personal level. But also, when you have a chronic pain, there are a negative like toxins and neurotransmitters released in the brain, and it can cause more depression and more low mood. And it's a vicious circle really that continues all the time. Regarding the activities, the patient is not able to do his normal activity, and this will lead to something we call it deconditioning. Patient will stop playing golf for old age people who love golf, or might stop going to the gym, might stop doing weightlifting. A lot of frustration comes because of the chronic pain. So it could be the knee issue only. So it's one organ or one part of the body that stops you from doing a lot of things that you love. And if you ignored it and keep doing it, you will lead to, more damage to the area. And not only more damage, you will have more pains in different areas adjacent to the original place. And this will affect your psychological status and will affect your relationship with the people around you. So you might have a difficult relationship at work or with your partner, or you are very nervous with your children. A lot of negative impact on your personal life, and you will also lose entertainment and enjoyment with different things that you love and you are used to do in your life. So there is a big backlog of things that could happen if you don't treat chronic pain, not only on the physical aspect, but also on the psychological and personal aspect. So you need really to consider your options when you have pain that is more than 3 months. And it's not 3 months only. I have patients who has 30 years chronic pain, 11 years chronic pain. And they went to so many specialists, including pain specialists, and they didn't get relief. So this first video that I'm presenting today is really about pain definition, why you need to treat it. And I have a lot of videos in my Facebook page. You can find in the same page a lot of videos with patients who completed their chronic pain treatment with me. And I think the good thing that I'm proud of really is that my patients are discharged from my service when I finish the treatment. So the treatment is not like patients should come every certain period to repeat injections. It's not every 3 months or 6 months or a year or whatever. No, I start the treatment with a multimodal approach, steroid injections, get a diagnosis confirmed, then I start the plasma-rich platelets. And this is the final part of my talk today. Plasma-rich platelets, which we use it as a regenerative medicine. And the plasma itself, I got a lot of questions also via WhatsApp and through the messenger, and they ask how it works. So plasma-rich platelets. Plasma is the first defensive mechanism in your body. if you have any damage or wound in the body. So I am always giving a very simple example. If you have a wound in your hand, the platelets first will stop the bleeding from that wound, and then the platelets will attract more platelets from your body to the wound and make something called platelet block to stop the bleeding and to start the repair process. So what we do in my clinic, I take about 15 mils of blood from you, then I centrifuge it to separate the platelets. And in these platelets, actually, there are many growth factors, like tens and tens of growth factors and neurotransmitters and amino acids and proteins. And when I separate these platelets, I inject it back into the area that has problem. It is perfect for, say, neck pain, the muscle, the trapezius muscle, the facet joints in the neck. It is perfect for nerve pain, and it is very good for any sport surgery, any sport problem. Like if you have tendon Achilles injury. I've treated a lot of tendon Achilles patients. I have treated a lot of rotator cuff in the shoulder when they have tendonitis and they have the rotator cuff tear. The platelets is going to work in the area where I injected for about 9 days. It stays active in the blood. And imagine when the platelets, you have a wound in the hand and the platelet migrate to repair that wound. It will work for a certain period in time. But when I inject the platelets, I'm not injecting it in a normal dose, because what I use, the type of platelets that I use, it's actually 3 to 5% more than your normal platelets. So say if your normal platelet is 250,000 or so, that's just a figure. The injection of the platelets back into the area is about 1 million. And imagine if you have 1 million cell or soldiers going to repair and fix the issue by having new tissue in that place, building new tissue from your own immune system. It stimulates your immune system and attract millions more and still keep active in the body for 9 days. So this is how it works in a very simple way. Of course, ladies put plasma-rich platelets in their face for to make it younger. And yes, platelets actually make a new cells and it repair the damage, but it is not called as a stem cell because it is not like the umbilical cord stem cells. This is different, but it works in a very similar way by repairing and building new cells and tissues in the area. And if you look at the videos with the patients that I have treated so far for different ages, different age group, different problems, from the back pain to the knee pain, so many things, you can find out that these patients, when they get 3 sessions of plasma-rich platelets, they actually will be discharged from the clinic because the pain will disappear for a long time. So far, I didn't have actually any patient who returned to me except for a very simple top-up or for different pain they wanted to treat. So I'm sorry I took so long today, but the topic is very interesting. I have got so many questions about it. I wanted to cover the topic as much as possible. I'm going to make more videos in the future, and I will speak about different problems in chronic pain, and we might do different topics like back pain, knee pain, hip pain, trigeminal neuralgia, and facial pain is really annoying, and pelvic pain, because I'm subspecialized in pelvic pain and in trigeminal neuralgia and facial pain. So these are my 2 areas of interest. So I'm hoping to meet you again in the future. Sorry for the late presentation today, but I know that in the summertime everyone wants to finish work and exercises and running and so and so. So I made it in the evening so everyone will be able as much as possible to watch the video. Thank you for listening today, and if you have any question, all details is on the website www.drmonamubarak.com. Also, you can text on the WhatsApp or on the Facebook or email us, and I'm going to reply to your email. Okay, thank you and a good evening. Bye bye.